Hi there, this is Dr. Michael Horwitz bringing you another episode of Podiatry Help Desk, brought to you by the Feet for Life Centers of St. Louis, Missouri. Today, I'm going to talk to you about something that many doctors treat, the Hammetoe deformity. Now, correction of hammertoes utilizing minimally invasive techniques is the subject of today's conversation. This is different than the treatment of rigid hammertoes using open procedures, K-wires, and sometimes even permanent implants. This is something that's much more simple. If this is something that you need, you'll know by the end of this video. And I suspect that you're looking down at the ground and you're seeing that your toes are progressively curling, and you're to the point now where you're contemplating doing something about it. Whether or not you can have a minimally invasive procedure performed on your toes to correct them and stop the further deformity is what we're going to discuss on this visit. So, as I've said before, my name is Dr. Michael Horwitz. I'm a board-certified podiatric surgeon with over 30 years experience practicing in the St. Louis area. I own the Mid-County Surgery Center, and I regularly perform flexor and extensor tenotomies on my patients that need them throughout the week as an office-based procedure. So let's talk about a simple, minimally invasive way to correct a hammertoe problem. Okay, hammertoes basically come in a number of different varieties. Sometimes they're contracted to the point where they rub the top of the shoe, and sometimes they mallet into the ground, and it's actually the tips of the toes that are in danger and are painful. And sometimes even the ball of the foot, as we'll talk about, becomes problematic because of the retrograde pressure placed on the ball of the foot due to the hammering of the toe. But we're going to talk today about the simplest of procedures that can be performed, called flexor and extensor tenotomies for the lesser toes, meaning usually toes 2, 3, 4, and 5. However, this can often involve the great toe. Now, these procedures are done routinely in office under local anesthesia by licensed podiatric surgeons. The goal is to correct the abnormal toe position caused by excessive tendon pull, whether that's flexion, hyperflexion, hyperextension. Whatever causes the deformity needs to be addressed in order to reduce the deformity. And what happens when you have these deformities is you can still get the same amount of pain, shoe rubbing, and pressure points on the bottom of the foot that the people with severe arthritic hammertoes complain of. You're just not that far along yet. So why does this matter? Well, most people recognize hammertoes because they see the joints bending or feel rubbing against the tops of their shoes. What's really less well known is that tendon imbalance can also shift the fat pad on the bottom of the foot, reducing cushioning and causing pain. So you might have gone to the doctor and gotten a diagnosis of metatarsalgia or capsulitis and never been informed that it's your toes that are producing a part or all of the force causing the pain. This is really worth considering. So a good sign of this imbalance is when the extensor tendons, the tendons on the top of the foot, are visibly prominent or bowstrung, like guitar strings. The good news is, even semi-rigid hammertoes, toes that are getting rigid but not quite there yet, can often be corrected with these tiny procedures without the use of stitches because the incisions are so small. Healing of a flexor or extensor tenotomy usually takes only a few days, and complications are extremely rare. Here's what happens during a tenotomy procedure. Patient comes into the office and they receive a local anesthetic, which is applied to the area of their foot that's going to be treated. Sometimes it's just of the toe, sometimes it's over the top and bottom of the foot. But essentially, suffice it to say, this is a quick numbing injection. Next, a tiny stab incision is made next to the affected tendon or over the tendon, depending on the technique. I use a fine blade called a MIS 64 blade. It's so small it's like a needle. But some doctors may actually use large bore needles and they can accomplish the same effect. The next step is to release the tendon with the instrument. Now when the tendon is cut, it heals slightly longer, and this allows the toe to relax into a straighter position. If all the lesser toes, meaning digits 2 through 5, are involved, then we'll treat them together because they share a common tendon structure. Sometimes we also gently manipulate the joint to free up any soft tissue restrictions and improve toe alignment. We refer to this often as a manipulation, and it's very safe. For the great toe, a flexor tenotomy at the interphalangeal joint can often straighten out a mallet toe in less than 30 seconds. So think about it. You've been living with, say, a mallet toe of the great toe for years, not thinking anything can be done. And you go into a doctor's office and the doctor says, I can fix that in 30 seconds. It's pretty difficult to believe, but I'm here to tell you that is accurate. And that can prevent further deformity and the necessity for interphalangeal fusion or other more invasive procedures. So what about recovery and results? Most patients are back in shoes within a few days. The dressing stays on about 48 hours. There's no splinting required beyond the initial bandage. Full tendon healing usually takes about 2 to 3 months, but improvement and comfort is immediate. A small percentage of patients may need a follow-up or a tweak procedure if one tendon remains too long or too tight. So essentially, you're trying to balance the tendons, and sometimes fixing this problem in the mix, or essentially waiting a few months and seeing what the effect of the surgery was, is really the important thing to do. And if you need an extra small little procedure to fix the toe, again, the opportunity cost is minimum. So what to expect? Well, the toes will not necessarily look perfectly straight after these procedures, but they will have less deformity. There'll be less pressure and less pain, and more importantly, less predisposition to go on to a condition that's worse. Satisfaction rates are very high. I perform, as I said, 2 to 3 of these each week, and I can't recall an unhappy patient when the expectations were clear. So who's a candidate? These procedures work well for most people, but there are important exceptions. So say you have diabetes. If your blood sugar is under control, you're fine. You can have this procedure safely. But if it's not under control, you should get it under control before considering any surgical intervention. If you have peripheral vascular disease, you can be a candidate for this procedure. However, if your toes are very cold or blue or poorly perfused, this may not be safe, and your surgeon will have to assess the risk. If you have neuropathy, or say you're an ulcer risk, or you're forming ulcers at the tips of your toes or on the tops of your toes, as in many diabetic and neuropathic patients, we actually do this procedure to prevent ulcers and cure ulcers, reducing these pressure points. So why does timing matter? Well, many people wait too long, and once the toe becomes rigid, it can't be corrected with a simple tenotomy alone. It requires a more invasive surgery like arthroplasty or toe implants. So if you're noticing progressive toe bending or pain, early evaluation can save you from a bigger surgery later on. That's the moral of this story. So if you've been dealing with toe pain, rubbing, or even pain on the ball of the foot and discomfort on the ball of the foot secondary to, again, the forces that are created by the hammer-toe deformities, you should ask your podiatrist if a minimally invasive flexor or extensor tenotomy could help. It's quick, it's low risk, and it's highly effective for the right patient population. I hope you've learned something today. And again, I can't stress enough the importance of second opinion. If you're unsure about your diagnosis or your doctor's treatment plan, I highly advocate that you seek second opinion, because a second set of eyes in these matters could make the difference between making a clean decision that will benefit you for the rest of your life or making a hasty decision that might cause you problems. I offer consultation online, and I'm open and consulting usually every day at 11:45 a.m. to people all over the country that have questions about their foot health. I'm Dr. Michael Horwitz. Thanks for watching, and we'll see you next time. Please, if you could, subscribe to my channel. It will motivate me to bring you even more content. This is the Podiatry Help Desk, and we're trying to bring you the best information that we possibly can to help you with your decision to help yourself when it comes to your foot pain. Okay, our patient is in recovery right now. He's doing great. He's getting a snack. And I wanted to make this recommendation to all the providers that are watching this video. Every patient of mine that undergoes any procedure or anything that might be complicated in the office gets a welcome to secure messaging barcode from us. It's a simple sheet that connects them to our secure messaging app. This technology is everywhere. There's absolutely no excuse for doctors not to be using it. By giving this to him and having him scan this, the Spruce app will pop up on his phone and he will have 24-hour access to me personally. He'll be able to text me or call me or even video conference with any questions he has. So this goes to the patient every time. It's very convenient, very secure, and I think it's one of the most important technological communication advances. Has been around for a while now. Doctors should be using these all the time. That's for you.
Thank you.
You're welcome.